Well, I think the big thing is it all comes down to patients, right? So I posted this research online, and one of the things I saw was something to the effect of this is not a clinical question. I have more than a decade in the clinic, and to me, it's a hugely clinical question. So if it does in fact match what the other research and other professions show, that using the title doctor does positively influence trust and or belief in trust, belief in caring, belief in competence, then I think we should probably start being that change in our profession. One of the things I see is a lot of people, complain about the profession and complain about changes they want to see in the profession. If we're less in the eyes of ourselves, then we're certainly going to be less in the eyes of others.
Today, we're welcoming a guest back to the show who spent time serving our country and now serving our profession. Dr. Lance Mabry is a retired Air Force physical therapist turned educator at High Point University, where he's helping shape the next generation of PTs. But that's not all. He's also making waves through his work with Redefine Health Education. Now, today, we're diving into a hot topic he's explored in his recent research. Should physical therapists be using the title doctor when introducing themselves to patients? It's more controversial than you might think, with legal battles and patient perceptions at the heart of it all. Get ready for an insightful and possibly surprising conversation. Lance is back on the podcast. Lance from High Point University with the branded background. Welcome back to the show.
Thank you. It's good being back.
Before we hit record, I said, what's new? You said more research. So we're going to talk about research today. But we're going to make it applicable, right? Like, I think some people get turned off on research because it can be dense. But there's a new tool out there. I took the research that we're going to talk about today. I copied it. I put it into GPT, and I said, explain it to me like I'm in 8th grade. And then I understood everything.
You have to send that to me. I'm ready. I'm excited to read it.
It's nice and easy. But even better than ChatGPT, I got the person who's responsible with it. This wasn't just you. I always want to make sure we mention co-authors, people who helped before we kick it in. So who was with you on this particular piece?
Yes. So the primary author is Justin Martino. He was a student at High Point he matriculated under me and recently graduated. He's now Dr. Martino, physical therapist, and Dr. James Smoliga, who's a veterinarian, is working for Tufts University.
So that's a cool mix. Title of the piece, which we're going to put a link in the show notes, Journal of Manual and Manipulative Therapy. But the title, I love it. I even did like a Twitter poll on it too. And that was one of the selections. I don't know if
you have to send me that too. Yeah.
Yeah. So the title is Not That Kind of Doctor, an exploratory study on doctor of physical therapy patient introductions in the United States. So first, let's just start with why'd you do this? What was there's got to be a pain point, right? There's got to be a question you want answered. What was the instigating sort of problem, question, whatever that started you three from going down this road and looking into this?
Yeah, so I think for me personally, I went through the same journey as many other physical therapists. I now earned this degree, this doctorate degree. Am I going to use this title? Am I Lance? Am I Dr. Mabry? Who am I? I think just like the rest of us, I tried different things out with patients to see what worked. And in the end, I found that, using the doctor title was actually very influential in helping patients be more adherent to their process, less of a friction point with, I'm just, the patient saying, I'm just here, treading water until I go back to the surgeon, and using that title kind of fixed a lot of those things and really helped with that patient experience. So in talking to other providers that have gone through the same journey, they kind of found the same thing, that using that doctoral title has been influential in patient care. So this is a question that's been burning inside me for years is, very, very clearly, in the first phase of PT literature, we are all comparing, manual therapy to exercise and doing those kind of things. Now we're getting into this pain science, contextual factors, what we say matters to patients. And my student at the time, Justin Martino, came up to me and said he had a passion. He wanted to do this. And I said, well, let's get it done. This is right in my alley. Let's figure it out. So, the first step we had to figure out before we take it to the clinic, because we do want to set up a clinical trial on this, is who's even using it. So are physical therapists using the doctoral title? And if so, why? And just figuring out, what metrics should we actually use when we hit the clinic with this question?
Now, if you're watching this on YouTube or if you're listening on a podcast, I would love for you to chime in. It's easier on YouTube if you just drop it below. If you're a PT, do you use the title or not? And even if you're not a PT, would you expect them, if they're doctorally trained, to use it or not? And then we can get into some of the reasons, and let's get into the reasons. So, Lance, your research found that only about 20% of physical therapists are using the term doctor during the patient introductions. Why do you think so many are hesitant to use it? And what are some of the top reasons that you found that sway those who do?
Well, I think one of the first things we found was setting was a factor. So those that are working in pelvic health were actually very likely, or comparably more likely, to use that title doctor than those that weren't. Orthopedics and sports was also similarly more higher compared to others. And as we would expect, lower areas was pediatrics, geriatrics, acute care, SNF. Actually, private practice was high. So the settings seemed to make a difference in whether or not people were using this or not. Because there are so many settings and so many patient populations, we didn't enter that into any kind of regression, but we did see huge differences in that part.
Therapeutic alliance is a major factor in that decision to use or not to use. I feel like I'm quoting Shakespeare. Help us understand how using or not using the term doctor can impact patient trust and communication. And have you seen any specific examples where this actually made a difference?
Yeah, so we actually asked the PTs, both those that were using the title and those that weren't, why were they using it, and why weren't they using it? So in those that were using the title, two of the things that pulled out as being highly influential was that to demonstrate expertise to their patients, and also to advance the profession. And that kind of ties to that therapeutic alliance piece. So when you look at the research, patients, when you use the title doctor in front of patients, they have a greater belief in the competence of the provider. They trust them more. They believe they are more caring and compassionate. The research isn't expansive in this, but there is this kind of suggestion that using your earned title doctor does positively impact that patient alliance through trust. However, it also popped out on those that don't use the title doctor. So those that don't use the title, their top reason was they felt that they believed it could confuse patients. And then the second one was therapeutic alliance. So both those that are using the title and not using the title are both using it or not using it because they believe it
Right.
improves therapeutic alliance. And only one of those things, I mean, it's possible that both are true. So imagine, maybe in a setting like pediatrics, not using the title improves that therapeutic alliance.
Sure.
Versus in, I don't know, sports, it improves the therapeutic alliance. So it's possible that both of those things are true, but we just don't know. So that's going to be one of the things, if we're hoping to get this into the clinic, that's going to be one of the things we're going to look into is, does that influence trust? Does it influence therapeutic alliance? And hopefully if we can extrapolate that out and actually track things like adherence and outcomes and things of that matter.
Let's zoom in a little bit too. Your study revealed some interesting demographic trends, such as older
Yeah.
PTs and males being more likely to use the title, and the opposite being true, right? Females and younger PTs maybe less likely.
Yeah.
What do you think's drive these differences, and how might it influence future generations of PTs?
Yeah, well, frankly, some of these were surprising. So one
Yeah,
of the things I hear in chat rooms was everybody was saying, "Oh, it's easier for the younger PTs. It's easier for PTs now to use doctor than it was, years ago when this first started." And if I had to guess what the research showed, is I would have guessed that it would have been that way, that
right.
newer PTs would have been more likely to use it, and maybe older, comparably less so. When we actually looked into the comments from the respondents. One of the things we saw was it took PTs a while of practice before they felt like they, quote, earned it. That it didn't feel right for them at first, and it took
Yeah,
them a while to get there. And frankly, that was my journey as well. My
yeah.
first few weeks, months, years out of school, I didn't use the title doctor, and it wasn't until it felt comfortable with me that I started using it. The other one was male gender. So there is some research coming out now. Physical therapy has been predominantly a female profession I
Right.
mean, since its inception, men weren't invited when
Right.
the PT profession was first made. Um, so now some of the research that's coming out that's showing that women are, have lesser leadership titles, have lesser pay in physical therapy. It was interesting to see that they are also less likely to use this title of doctor versus men aren't. So I do think that there's some psychological factors that could be of value to tease out there. That's probably beyond my skill set to tease
Right.
those out, but I do think that that's an interesting parallel to some of the other research we have coming out.
Yeah. There's also some legal implications. People bring this up. This makes its rounds on Twitter every once in a while,
Mhm.
involving healthcare professionals and the use of this title doctor. Help us understand more about that. How might PTs navigate these challenges without causing the things that most of the clinicians are trying to avoid: patient confusion or facing legal consequences? We want to do it for the right reasons in the right way.
Here's a question for you. Do you want to boost your clinic revenue by $290 per patient per quarter? Of course you do. That's rhetorical. Physiotech's remote therapeutic monitoring can help you do that, enhance patient outcomes, ease provider workload, and turbocharge your earnings. Kickstart with RTM at physiotech.ca. That's physiotech.ca. And the thing you interact with the most at your clinic, if you're a therapist, like it or not, is your EMR. MW Therapy's all-in-one outpatient PT EMR gives you seamless integration of patient portals, marketing automations, and billing, all at one unbelievable value. Switching over is a breeze too. Kick the tires, take a test drive at mwtherapy.com. And where is your PT career going? It's not rhetorical, it's literal. Embark on extraordinary patient care adventures with Jackson Therapy Partners. Visit them at jacksontherapy.com. This is perfect for physical therapists eager to make their mark, to do what you want to do, where you want to do it. Discover where your career can take you at jacksontherapy.com.
Sure. Well, if you look at one thing, always check with if you're ever worried, always look at your state board and your practice act.
Yep.
So one thing I'll say to PTs is what we can and can't do does not live solely in the practice act. This isn't something I realized until I actually started digging in here. A lot of the granular stuff on what we can and can't do is spelled out by board rules and board opinions.
Huh.
So making sure you're familiar with those is of value. However, those that get more detailed on this pretty much say that you have to pair the word physical therapist with doctor. So, when I'm meeting my patients, hello, I'm Dr. Mabry. I'm a physical therapist. And I haven't had any issues with patient confusion. I've used it on inpatient. I've used it outpatient. I haven't had anybody ask me for a colonoscopy yet. So, tying that physical therapist, again, look at your state, but tying that physical therapist to the introduction is important. There is a case that came out recently of a doctor of nurse practitioner that got sued because she used her title doctor. And interestingly, she actually worked in a clinic that was owned by a physician, and she was encouraged by the owner and the physician to use that title doctor. So there was a lawsuit that came out about it. My understanding is there's that case might come up again, that the final outcome of the case is still pending. I'm curious to see where this shakes out, but I do think that ultimately the word doctor is going to be very difficult to defend because it's been used in academia before it was used
Right.
in medicine.
Yeah. As topics like this evolves, what changes would you personally like to see in the profession regarding title usage, and what role do you think it could play in advancing the profession as a whole?
Well, I think the big thing is it all comes down to patients, right? So I posted this research online, and one of the things I saw was something to the effect of this is not a clinical question, and frankly, to me, I am a clinician. I have more than a decade in the clinic. I still see patients, and to me, it's a hugely clinical question. That contextual factor and how that influences patients and their outcomes is hugely important. So, where I would like to see this going is, one, we have to figure out, is this a net positive for patients overall?
Sure.
Does that vary by population? Does that vary by age? Does that vary by demographic? Not just in the PTs, but also in their patients. And then how can that help guide our care and help influence our care? So, if it does in fact match what the other research and other professions show, that using the title doctor does positively influence trust and or belief in trust, belief in caring, belief in competence, then I think we should probably start being that change in our profession. And
Yeah.
and one of the things I see, you and I are both on social media. One of the things I see is a lot of people, complain about the profession and complain about changes they want to see in the profession. But the same people that are complaining aren't willing to actually make the changes. So let's make the changes, right? So if we are going to diminish ourselves as a profession, then we're going to be, if we're less in the eyes of ourselves, then we're certainly going to be less in the eyes of others.
Yeah. No one questions Dr. Seuss. No one's ever asked him for his credentials, but we just truck that Dr. Seuss is, in fact, a full doctor. Not that kind of
Yeah, for
doctor.
sure.
An exploratory study on Doctor of Physical Therapy, patient introductions in the United States. Again, we'll share that link in the show notes in the description below. Some other findings on top of, we said at the top of the show, only 1 in 5 PTs use doctor title, around 20%. Older PTs and male PTs are more likely to use the title. Also, experience matters too. PTs who completed extra training, like a residency program, were more likely to use the title. However, PTs who serve at as clinical instructors, or CIs, who train student PTs, were less likely to use the title. So imagine you're a student, you'd be very confused. Of course, you're going to come out very,
Yeah.
you've got professors in class telling you, maybe instructing one thing, then you go to a CI, it's a different thing. You're watching what everyone else is doing. No wonder students and younger physical therapists would be confused.
I think everybody's kind of going through this journey. How, are we going to use this? Are we not going to use this? I think everybody at some point asks themselves this question. And, when we do control for the other two major factors, age and gender, those that completed a residency program more likely. But as you said, those that serve as CIs were less likely to use the term a doctor. So,
Interesting.
this was very much an exploratory study.
Mhm.
That's in the title, that it's an
Sure.
exploratory study. And as we dug into this, there were things that, usually as a researcher, you build a study and you kind of know what the outcome's going to be before you even do the
Right.
study. There were things that shook out about this that surprised me. Why are CIs less likely to use their title doctor? Is it, does it kind of predispose which people choose to be CIs, or which clinics are minimal to CIs, or
Right.
that was something that shook out that we just did not expect.
Yeah. Some other information, reasons for using or not using the title. We mentioned some of those before. Why some PTs use the doctor title: to show expertise, because they feel like they've earned the title, which they have, and to help advance the profession of physical therapy. If we all do this, it will change perception, and perception could be reality. And why others might avoid it: concerns about confusing patients, which I can empathize with, or worrying that using the title might hurt their relationship with patients, that therapeutic alliance. Anything I didn't ask about this, or that came up that surprised you in a good or interesting way?
Yeah. So you mentioned about advancing the profession. So, when you look at some of the research that we found on this is from optometry. So optometry has the same question. If optometrists, which are now doctors, the research suggests, hey, we should be using this title to advance our profession. Interestingly, one of our co-authors on this, Dr. James Smoliga, is a veterinarian,
Right.
and he said that veterinarians were the original not that kind of doctors. That veterinarians went through this same journey of, are we doctors? Are we not doctors? Should we, are we doctors with our patients? And they've kind of gotten to the other end of that, and yes, they are. And looking at podiatrists, kind of going through the same journey. There are now surgical and non-surgical podiatrists. Podiatrists years ago were doing a lot with inserts and lifts and various other things, but now podiatrists are in the operating room and they're performing surgery. They don't have an MD, they don't have a DO, they have a DPM, a doctor of podiatric medicine. They have come out on the other end, and nobody questions when they use the title doctor, or not that I've seen. So I think our journey is going the same way. I think we are going to come out on the other side where we're probably using it more than not. So just one clarifying point. So it's not 20% of PTs, but it's 20% of doctorally trained PTs.
Understood.
Because obviously masters and bachelors trained PTs probably can't use that title. But when you look at the curve of innovations, there's the early adapters, and then once you hit a certain threshold, then things kind of really take off. When you look at where we are with 20% of DPTs using it, I think we're kind of really close to that threshold where you're going to see this. You're going to see this change, and it's going to be it's going to be a fast change, I believe.
Right. Yeah. Mentioning veterinarians and podiatrists, veterinarians being the guinea pig. See what I did there? And then podiatrists, right, blazing the trails. Dr. Scholes, teaching us the way of making sure we understand who those professionals are.
Oh, yeah.
Lance, last thing we do on the show, as you are aware, is the parting shot. What would you want to leave with the audience about what you learned with your co-authors on this?
Oh man, I think the big thing is uh, for me is embrace the change. So when we started digging into the background on this, I didn't expect to find so much research on using the title doctor and that it would be positive. I grew up with you don't wear a white coat because it makes people's blood pressures high. The
Right.
white coat syndrome. That's what I expected to see when I dug into the research on this to write the introduction. And as we started digging in more and more, now again, there's not abundant research, but the research seemed overwhelmingly positive in favor of using the title doctor, which surprised me. So ultimately, I would say for those that are running in the opposite direction and saying it's for therapeutic alliance, or the other thing I see is those that use the title doctor are just arrogant, and
Right.
that's not what I'm seeing at all. The top two of the top three reasons is, kind of that build that trust with patients through our expertise, that therapeutic alliance, and advancing the professions. This is all very altruistic stuff. So I think we need to lower our swords a little bit and start listening to both sides and see where we are. And then again, just taking that next step. The next step is let's take it to this clinic. Let's take it to the clinic and let's see what shakes out with patients.
I'm the kind of research guy that I love it goes on, but I'm probably not going to do it anytime soon. But there's probably room for this. Again, this is a non-research guy asking a research guy. There's probably room for this. We probably should ask patients, right? Someone should be doing some research where they ask patients their perceptions. So we're not guessing at what the other half of this therapeutic alliance is thinking or feeling.
Yeah, no, and that's what we're hoping to do next. So,
Good.
what I'd like to see next, we haven't set up the study, we haven't gone to an IRB. What I'd like to do next is take it to a patient and dichotomize, randomize what the therapist is introducing themselves as. Are they introducing themselves as Lance, or are they introducing themselves as Dr. Lance Mabry, your physical therapist? And then afterwards, seeing what shakes out. Does that change trust? Does that change, adherence? Does that change outcomes? That's where I'd love to see that go. That's obviously going to take a lot more manpower and a lot more time and effort. There are also some smaller stuff that can be done as well. I just posted a picture that was done by Devlin et al. Back in 2009. They actually took snapshots of offices and put diplomas in some offices and no diplomas in others,
Huh.
and asked patients what they thought. And patients thought those that had diplomas on the wall were more qualified, more energetic. And those that had diplomas were also more qualified and energetic, but that was heightened when you added family photos in there. So
Wild.
very, very minor tweaks that we can do to influence all the great stuff we already do. We're already great at exercise. We're already great at manual therapy or dry needling or whatever our skill set is. We're already great with that. This is just doing one extra little thing. Put up a picture of your family in your clinic. Put up your diploma on the wall, and see how that influences patients.
Well done. One more time, not that kind of doctor, an exploratory study. I'm Doctor of Physical Therapy, Patient Introductions to the United States. Lance, thanks for stopping by to help us understand a little more about research.
Thank you much. I appreciate you having me.